Violence towards healthcare workers. A poll from January 2024 conducted by the American College of Emergency Physicians revealed that 91% of respondents had either personally experienced violence in the workplace or were aware of a colleague who was a victim of violence in the past year. 40% knew of an attack on a healthcare worker in a trauma center that resulted in moderate to severe disability or death. The numbers are and should be staggering. The issue's only gotten worse, especially since COVID. The question is, how can we get a federal bill passed to decrease violence towards healthcare workers? Starting off with a horrible metric, healthcare workers are prone to more violence, more so than any other private sectors. 4.2 per 10,000 workers compared to 2.9 per 10,000 in all other industries. There has been a positive trend with the current efforts, and there hasn't been an improvement with each consecutive year. Current laws, policies, and standards are loose and aren't uniform across the United States. Violence affects more than just the victim, and by implementing different policies and laws, there can be a decrease in cases of violence, which in turn can decrease burnout and the general mental health of workers, increase the quality of patient care, and reduce the financial burden on hospitals that are diverted from the hospital budget. Some social factors, in many instances, cultural and social norms of violence is quote unquote part of the job for healthcare workers. This leads to discouragement from reporting violence. Another social factor includes misinformation from conspiracy theories online since COVID-19 epidemic, which fuels aggression, frustration, and mistrust towards healthcare workers. Tensions can also arise from patients who have to wait longer for care, overcrowding in the hospital, and poor communication among healthcare workers and patients. Economic factors include longer wait times due to shortages, and shortages arise from high turnover rates and burnout from staff constantly being understaffed, causing further strain on the hospital systems and prolonged wait times. Poor planning of infrastructure and layout, designs, and security increases the stress and vulnerability of the hospital staff. Also contributes to an increased violence towards healthcare workers. With an increased amount of violence, it causes an increase of expense towards violence-related costs, such as cost of caring of staff, replacing the staff, prevention, such as increased security and training, infrastructure damage, and legal fees. Some legal and political factors, there are states that are lackluster in political legal consequences to violence towards healthcare workers. There is a lack of constant penalization throughout the country, leaving some healthcare workers more at risk. Current regulations and recommendations from OSHA and the Joint Commission have very loose, suggestive standards to reduce violence, although this is left for the hospital systems to decide how much intervention they want to implement for prevention. As far as ethical goes, medical staff have an obligation to care for a patient despite if the patient is violent or not. This increases the risk for healthcare workers as they don't get to always pick and choose who they care for. Violence is disproportionately higher in areas with higher crime rates and marginalized communities. So as far as alternatives, the Safe Healthcare Workers Act is a pending bill introduced to committees in both the House and Senate chambers in May of 2025. This act will make assaulting healthcare workers a federal crime, similar to the way airline personnel are protected. This hopefully will act as a deterrence to violence. Many states, such as Missouri, OSHA has legal authority under the General Duties Clause, not requiring but recommending treatment or training and a written plan to reduce violence in the healthcare setting. OSHA recommends preventative actions, but leaves it up to the facilities on their policies. OSHA standards vary from state to state, some of which have higher standards that are mandatory and proactive to prevent violence. So the more viable policy here is the Safe the Healthcare Workers Act. Although this law would be federal, it would umbrella all states. Requiring to get the bill signed and passed would require collaborating with key stakeholders. This would include healthcare workers, organizations, politicians, and the general public. The first step is to establish a shared goal, mission, vision in violence towards healthcare workers for optimal unification. This can be done in person or virtual meetings by forum. Once collaborations are established, having regular check-ins for agendas, discussions, upcoming actions would have to be incorporated as a feedback system. To promote the policy alternative among stakeholders would require coordination and an evidence-based advocacy campaign that blends a few tactics to press on the point of violence towards healthcare workers. This would include stories from frontline workers, framing the issue as a concern to everyone involved in healthcare and involving organizations that can aid. Having frontline workers who have been victims to speak out and give testimonials can humanize the issue and build empathy towards the public. Involving hospital administration on cost savings by reducing turnover can incentivize support from healthcare systems. Framing this issue as bipartisan can help get backing from other politicians. The more the idea is brought to light to the public and organizations that are affected, the more there's support towards pushing this bill to becoming a law. And that's all, folks.